Hello, my name is Dr. Chapman. I'm a board certified rheumatologist in upstate New York. Today, I'd like to discuss positive ANAs. This is a commonly asked question and a common reason to be referred to a rheumatology practice. If you like this channel, a like and subscribe, and let's get to it. So, what is a positive ANA? So, an ANA is a type of blood test that is used to identify individuals that have a possible autoimmune condition like lupus. So, what happens is that the body can produce certain antibodies that are directed against the nucleus of a cell, and that's really what it measures. Now, it also helps us identify how concentrated the ANAs are in the blood, and that's where you get your titer. So you may see 1 to 80, 1 to 160, 1 to 320, so on and so forth. So those are basically the number of times that the blood needs to be washed until you really don't see it. So the higher the ratio, the more concentrated the ANA is in your blood. The second thing that we measure is how it looks like on a microscope. So this is where you get that second part where you see homogeneous pattern, speckled pattern, dense fine speckled pattern, centromere, nucleolar. Now, depending on the actual pattern, it can give you some information about what may be going on. I always take these with a grain of salt because they're not terrible. They're change every time you kind of like test. So it's not really giving us that accurate information. The only, or rather, the two only ones that I really, when I see that pattern, it really does help me define what may be happening as nucleolar as well as centromere. These are pretty specific for scleroderma. Now, it's also really important to note that just having that particular ANA in that particular titer doesn't necessarily um, help us diagnose the actual condition. Ultimately, you have to look at symptoms. So, what are causes for possible ANA? So, we've already talked about autoimmune conditions, so things like lupus, myositis, scleroderma, Sjogren's syndrome. But yes, you can see positive ANAs in autoimmune conditions, but you can also see it associated with certain infections. So it's not uncommon to see someone have a positive ANA after contracting COVID, for example, or Lyme disease or Epstein-Barr virus infection. You also can see it after being exposed to certain medications. So things like hydralazine, minocycline, that's very common to see that. And in individuals receiving medications to treat autoimmune conditions. So it's very commonly seen after being treated with Remicade for things like Crohn's disease or ulcerative colitis. And then what makes things a little bit more complicated is that you can see ANAs in individuals that are perfectly healthy. You've tested positive for an ANA, and now you're left with, do I do something about this? Am I sick? Or is it just a blood test that I have to be aware of? This is where consulting with a trained rheumatologist is really important. Um, Ultimately, history and physical examination are the most important thing when making diagnoses. Now, this isn't to say that the rheumatologist won't order more blood tests. They probably will, a lot probably. So some of the most common things that will be drawn are things like cell counts and liver function, kidney function, looking at your urine, and also specific antibodies. So these are antibodies that we generally find in specific certain diseases. So for as an example, let's say someone's presenting with muscle fatigue as well as a rash that tends to pop up when exposed to light. So there may be a concern for possible condition like dermatomyositis. So the doctor probably will order specific testing like a Jo-1 antibody, as well as markers for muscle inflammation. So this is just an example, but essentially the rheumatologist will try to target their workup for that particular history and particular clinical findings. So I hope this video was helpful. If you have any specific questions pertaining to yourself, I would recommend that you consult with a rheumatologist. But if you have any general questions regarding topics in rheumatology, please leave your questions in the comments below. And if you like and you'd like to see more videos like this, please like and subscribe. Take care.